live anymore. We'll do them non-live, but I prefer live because it's more fun and it's easier. So having said that, today's video is about why do I have a herniated disc? But really this came up because I had a question on YouTube this week. I don't know what day it was, maybe yesterday, Thursday. And it said, will running marathons cause herniated discs? And the answer is sometimes. Sometimes it will. Not everybody that runs marathons is going to get a herniated disc, and there's a reason. So in the end, there's really a reason that you get herniated discs. And it doesn't matter if you're a marathon runner. We get professional golfers that come to see us. We had one last week. I think we're going to have another one next week. People that work at a desk all day long. If you have something out of balance, then you will eventually have a disc problem. That's pretty extreme, but it's kind of, the longer things are out of balance and the more they wear out, the more likely you are to have a problem. Again, why do we do this? Well, first of all, we do these videos so you know that you have options, that there are solutions to your problems. It's not uncommon. When you have a back problem, doctor says, oh, you got to live with it because there's nothing we can do. They're only saying that because there's nothing they can do. Okay? We can solve these problems. 25 years of doing this, I think we did the numbers, over 12 to 13,000, I'll have to get the exact number, herniated discs. Okay, so we treat a lot of herniated discs. We treat a lot of severe back problems, and there is a way out. And we do what we do because I solved my herniated disc. Okay, I had a herniated disc that happened when I was in college, and I lived with it for a long time. Because I didn't think it would ever go away, because everything I did didn't help, and finally we found a way out. There's no drugs, there's no surgery, so we treat more herniated discs than anybody. And we treat them successfully. And we have a study coming out that sort of validates all that. We've got 2 that have already been published. We got another one that's going to be published, well, it's in review right now, in a major medical journal. So I do these videos because my experience with treating all the patients that we treat is the one thing that is very necessary for the patient is to understand why they have the problem and why we're doing the treatment to fix that problem. Because every treatment, there's a specific thing that we're targeting. Now, this is a lot about the herniated disc, but we're going to talk about why you have the herniated disc and what effect it has on the marathon runner. Because that came up this week. 2 things came up. One of them is how do they heal? How does a herniated disc heal? And we'll talk about that Monday. And I wanted to talk about Gabriel as well. He did it. We had a testimonial video from him. His story is unbelievable. So I want to talk about that on Monday, hopefully. I was going to try to do it today, but it's getting kind of late. So typical spine looks like this. Head's up here, hips are down here. Remember, it's all about the why do I have this problem? Why is it not going away? Why do I need to do these treatments? 24 vertebrae between the head and the hips. The vertebrae are the bones. In between each bone, there is a disc. The disc allows for motion. Okay? The disc is a lot like a jelly donut in the sense that in between each vertebrae, the outer portion of the disc, there's a thick material we call the annulus, and the inner portion of the disc, there's a jelly-like substance, we call that the nucleus. The nucleus gives stability to the disc. The nucleus gives stability to the disc the same way air gives stability to your tire. When the nucleus is properly hydrated, the disc is healthy. The nucleus is designed to distribute stresses evenly in all directions. So when the center of gravity goes right through the middle of the spine, the stresses are distributed evenly in all directions on the annulus. What happens sometimes is the angle of the load changes. So when the center of gravity goes through the middle, we're kind of looking at it this way here. When the center of gravity goes through the middle, the stresses are distributed evenly in all directions on the disc. That's super, super, super important because when the angle of the load changes on the disc will start to break down. So when your disc has more pressure in one area, what happens is it'll load all the pressure into that portion of the annulus. I weigh 200 pounds. In an upright position, I'll have maybe 150 pounds of pressure on the lowest disc in my low back. Okay, that's a lot of pressure. If the angle of the load changes, now I have 150 pounds of pressure on one portion of the annulus. And that 150 pounds of pressure on that one portion of the annulus very often will cause the disc to start to break down. So when you have the angle of the load in the wrong position for too long, over time what happens is you get a little tearing of the annulus. And as the annulus starts to tear, the nucleus starts to push out. As the nucleus starts to push out, you'll develop what's called a bulging disc. So the longer the angle of the load is out of position or forced into one area, the more you're going to have a breakdown of that portion of the disc. That'll lead to bulging discs. People say, oh, it's the worst thing I ever had. How'd they get better? Well, if the angle of the load is out of position for too long, it's going to perpetuate the problem. So part of what we do is balance the load across the disc. But having said that, the longer it's there, over time what happens is the tear will get bigger. And as the tear gets bigger, the nucleus pushes further. Again, this is why do I have a herniated disc? Okay? As it pushes further, now the disc is herniated. And it'll start to push into the spinal canal. And sometimes it'll start to pinch the nerves as they exit through the foramen. And that pinching of that nerve will cause the pain that goes down the leg. Okay? So the herniated disc will also cause, the number one reason for sciatica is the herniated disc. So the question is, why does this happen? And if you are a marathon runner, why did it happen to you? And we've treated lots of marathon runners that had herniated discs before we treated them. They couldn't run. After we treated them, they were able to run marathons again. Marathon runners love to run. Okay, they love to run. I'm not a lover of running, but I do run, but I won't run a marathon. Just saying. But I know that people that do that, they do it. They love it. Absolutely are in love with it, for sure. So the question is why? All right, this is all about why. Well, sometimes what happens is you can get a little bit of a problem in your hip. Not a big problem, no pain. Muscle imbalance causes a little bit of shifting, maybe shifting of the pelvis, and it goes a little bit out of alignment, not completely out of alignment, but a little bit out of alignment. And the more you run on the misaligned spine, what happens is it forces all the load into one portion of the annulus. Okay? So this load is going to be on one portion of the annulus. Whoops. Come on, baby. And it's because the pelvis is slightly aligned, and it can be just millimeters. And it's very often the result of a problem within the hip, a dysfunctional hip. Not a terrible problem, but enough to where the longer you're running, the more it's aggravating and pushing on that. And then what happens is the longer you run and things are a little bit out of balance, especially for marathon runners because they'll run forever, as you do that, then the disc will start to herniate. So some marathon runners will develop herniated discs, but usually there's some level of dysfunction that's happening as you're running that eventually causes the disc to break down, and one day it gives out. It's a herniated disc. Has a lot to do with a little bit out of alignment and or your posture, because they're very much connected. If you have posture that's maybe not great, you're going to overload the disc, especially when you're doing marathon running. So some marathon runners will get herniated discs. We treat them. That happens. Okay? But some won't. Some will never, ever, ever have a problem because everything's in alignment. Everything's in balance. You need balance and alignment. Our goal in our therapy is balance and alignment. Okay? Functional disc stabilization is what we do. We restore function, balance, alignment, stabilization, muscles holding as they should on the disc. Okay? So patients that have this dysfunction, we had a patient come in, 3 herniated discs in the back, marathon runner, Had gone to 3 separate surgeons. They all said, you can't run anymore. No more running for you. You're done. Stop. Okay? Came in to see us. Hadn't been running, I think, a year and a half. He hadn't run. Again, runners like to run. That's what they do. Evaluated his spine. We saw the MRI, 3 herniated discs. Evaluated the hips and the pelvis. Hips were out of alignment. Not a lot, but enough to where it caused wear and tear. Every time you ran, wear and tear, wear and tear. What do? We restore the function to the disc. We take pressure off the disc. We get healing in the disc. We get the herniations to move back to the inside slowly over time. And then we restore function to the spine and to the hips. And he was able to run marathons again. Multiple marathons. Okay, not one, because he had dysfunction and an alignment problem. Herniated disc looks like this, pushing into the spinal canal. After the therapy, herniated disc goes away. We treat the herniated discs. They do get better. This is a massive herniated disc. After the therapy, went away. Again, very large herniated disc, better. This one's big, better. Whoop, that's it. That's all I got. So the question is, will marathon running cause herniated discs? If you have a dysfunction and things are out of balance, you run the risk of causing more damage to your disc. But it doesn't matter if you're a runner, or you're a sitter, or you're a golfer. Okay, if you have something out of alignment and it's not in balance and you don't have normal function, it's going to wear out over time. That's why you get herniated discs. There's no mystery.